Greetings of the day. Myself Payambora, pursuing MS Pharm in Pharmacology and Toxicology from Naipur Mohali. I am here to present a short presentation on monoclonal antibodies. When we talk about functioning of the immune system, it is brought about by two types of immune responses, humoral and cell mediated, that are involved in production of B cells and T cells, which further lead to production of plasma B cells and memory B cells. And in T cells, that is cell mediated immunity, we have cytotoxic T cells, helper T cells, memory T cells, and suppressor T cells that help in defense against intracellular pathogens as well as extracellular pathogens. There are a few points of differentiation between polyclonal and monoclonal antibodies. Like polyclonal antibodies have many B cell clones, they have multiple epitopes of all antigens, and it is a mixture of different antibody isotypes, while monoclonal antibodies is a single B cell clone, a single epitope of a single antigen, and it has all of a single antibody class. To introduce monoclonal antibodies, the monoclonal antibodies are monospecific and identical. They are produced from a single B cells, and it is formed by fusion of a B cell and a myeloma cell in a hat medium, in which the fusing agent is PEG, polyethylene glycol. We will further discuss the process of production of these monoclonal antibodies by hybridoma cell technology. The hybridoma cells, these are highly specific engineered cells, that is a fused B cell and a myeloma cell. So in the medium, there will be fused B cells, there will be fused myeloma cells, but our interest is in the fused B cell and myeloma cell, which is a hybridoma cell. The hat trick is useful as a medium in the selection of hybridoma cell. The hat stands for hypoxanthine, aminopterin, and thymidine medium, which is used in the progress of the salvage pathway, which is a nucleic acid biosynthesis pathway. And only B cells that have fused with the myeloma cells will be able to survive and grow in this hat medium. The different practical steps involved in monoclonal antibody production are firstly immunization in animals, that is exposure to the relevant antigen, then isolation of the spleen cells to obtain plasma B cells, then the fused spleen cells along with the myeloma cells are kept in the PEG medium, which is a fusing agent for complete fusion. Then these are the unfused B cells are allowed to die. Then aminopterin is added. Why? So that the unfused myeloma cells can also die. And finally, the remaining cells are cloned, either using cell plate technique or there is in vitro propagation. There are different types of cloning and propagation techniques. There is screening of the supernatant of each clone, and the grow of then these clone cells are being grown. And finally, the antibody is harvested. There could be different components and contaminants while we are producing this monoclonal antibodies. These could be hormones, growth factors, transference of the media, or the different endotoxins, bacterial components, or viral cell components. So there are different methods for purification. Either we can go for filtration, ultrafiltration, or chromatography techniques like ion exchange chromatography, cationic or anionic, so that there is removal or elimination of anionic impurities, or we can go for size exclusion chromatography techniques. This is a diagrammatic representation of how a plasma B cell fuses with a myeloma cells. So here you can see that how there is unfused plasma cells. This is a fused plasma cell. This is a hybridoma cell or a hybrid cell that we actually need. The B cell fused with a myeloma cell. This is fused myeloma cells, and this represents unfused myeloma cells. So this is a diagrammatic representation of different kinds of cells that will be available in the media. Now, in the presence of hat media, only the fused cells will not undergo senescence. It will be able to survive in the hat media because it uses salvage pathway, which is a fused B cell and a myeloma cells, while rest all the other cells, as you can see, will undergo senescence and die. There are different types of antibodies that are produced. Now, these monoclonal antibodies, depending upon the nature, have different suffixes like MAB. So it is a monoclonal antibody. So omalizumab, daclizumab, trastuzumab, These are all kinds of monoclonal antibodies. When there is a suffix of MOMAB, it is a mouse monoclonal antibody. Rituximab, it is a chimeric monoclonal antibody. If it is a humanized monoclonal antibody, Zumab, so omalizumab. When it is a human monoclonal antibody, Mumab. When it is tumor-directed monoclonal antibody, Tuxxmab. These are the different kinds of suffixes and different kinds of monoclonal antibodies that are produced. When we talk about market insights of monoclonal antibodies, so by source there are different kinds of marketing sources and the nature of the production of these antibodies like murine, chimeric, humanized, human. By region, these are the top 5 regions where monoclonal antibodies are being highly marketed: North America, Europe, Asia Pacific, Latin America, and Middle East and Africa. By application, that can be used in vivo or in vitro. By the end user, they can be classified as special centers, hospitals, or other specialty centers. By the production, they can be useful in oncology. So there is trastuzumab, which is a HER2 inhibitor, omalizumab, which is an anti-IgE antibody useful in asthma, and autoimmune diseases. There are different kinds of antibodies like tocilizumab, which is interleukin 6 inhibitors that are useful, daclizumab. Then when you talk about infectious disease, there are various monoclonal antibodies that are being produced for leishmaniasis and other infectious diseases. For neurological diseases, there are certain targeted monoclonal antibodies for Alzheimer's, Parkinson, and Huntington that are being under the phases of clinical trials. The different market players in this monoclonal antibodies are AstraZeneca, Bayer, Biogen, Squibb, Abbott, Eli Lilly, GSK, Johnson and Johnson, Biocon, Merck, and Novo and Novartis. When we talk about the global market value of monoclonal antibodies, so as you can see, a significant growth or an exponential increase from the 2020 to 2030 is expected in the 4 types of monoclonal antibodies: human, humanized, chimeric, and murine. And a CAGR of 10.6% in the US is expected from the year 2023 to 2030. And these are different references from which I've taken the data from. Furthermore, to observe the global trends in monoclonal antibodies marketing. So here you can see the different market values and year-on-year growth, YOY. So from 2018 to 2019, there has been reduction in the year growth. And then again, there is a reduction in the year growth of 11.7%. But then suddenly there is an expected increase in the year-on-year growth of the market value of global monoclonal antibodies. Because of high production rate and because of highly specificity, they can be useful in for a scale up and for useful in different kinds of infectious disease as well as other kinds of disorders. These are the different retrospective studies or the studies that have been involved in the production of antibodies right from 1994 to 2007. So you can see a list of antibodies: abciximab, which is useful as a GP2B3 antagonist, cardiovascular antiplatelet action; adalimumab, which is useful in rheumatoid arthritis as it is a TNF alpha inhibitor; cetuximab, which is a EGFR inhibitor useful in colorectal cancer; bevacizumab, which is also useful as in colorectal cancer because it is a VEGF receptor antagonist. And these are the list of different antibodies: infliximab, natalizumab, trastuzumab, which is Herceptin. So this is a list of brand names, their approval dates, the type of monoclonal antibodies, the target on which they act, and finally the approved treatment or the indication in which they are given. So macular degeneration, maybe we have ranibizumab. For non-Hodgkin's lymphoma, we have rituximab. For breast cancer, we have trastuzumab. For respiratory syncytial virus, we have palivizumab. So similarly, for multiple sclerosis, we have natalizumab. Then we have muromonab CD3, which is very useful in transplant rejection or as immunomodulatory agent. So these are the different indications in which their use has been approved. When we talk about the different kinds of studies that are involved, so the other examples of few other agents and their monoclonal products are like Eli Lilly, Orthobiotech, Biogen, PDLI, Johnson and Johnson, Novartis, and these are the different monoclonal antibodies or the monoclonal products that they have produced, the indications, and finally the FDA approval dates. Here are the list of targets of monoclonal antibodies on which they act and the generic names as well. So when we talk about interleukin 2 inhibitor, we have daclizumab, and it is useful in multiple sclerosis. Similarly, there are different interleukin targeting because they have inflammatory as well as anti-inflammatory properties. So different interleukins, we have different targets. Similarly, for chemokine co-receptor, we have ogelamilizumab, which is useful in cutaneous T-cell lymphoma. Then we have anti-amyloid solanezumab, which is very, very useful in Alzheimer's disease. So you can see there's a list of target, generic name, and the indication. List of recently approved monoclonal antibodies involve teplizumab by Tizeld in November 2022 for type 1 diabetes. And then you can see the list of different kinds of latest monoclonal antibodies. We also have a synergistic combination of nivolumab and relatlimab by Opdualag in March 2022 for unresectable or metastatic melanoma. Then we have lesinimab by Leqembi Pharma, which was approved in the year January 2023 for Alzheimer's disease. Moving on to have a future insights of the monoclonal antibodies. There are different antibodies name, their targets, their indication, and their probable chances of approval. Currently, they are under review and the clinical trial processes. So you can see deruxtecan, zenositumab, nemolizumab, zanitamab. So we spoke about the retrospective studies, the currently approved treatments, and the prospective studies or the future insights of the monoclonal antibodies. The future scope involves these are the different articles that represent how monoclonal antibodies can be used in antimicrobial resistance and in treatment of malaria. So these are the future scope of different production of monoclonal antibodies. When we talk about uses of monoclonal antibodies, we can talk about they are useful in measuring protein levels, typing tissues and blood, identifying infectious agents, identifying clusters of different kinds of follow-up therapies, identifying metastasis, identifying hormones, and immunoaffinity purifications. So they can be used in therapeutic, diagnostic, or clinical applications, either in the transplant, cardiovascular, infectious, inflammatory, or cancerous conditions. In diagnostic applications, they can be used in ICC, immunocytochemistry, which is useful in prostate-specific antigen marker, classification of tumors, and distinguish morphologically certain lesions. So that's it for today's presentation. Thank you so much for your patient listening. Thank you so much for giving me this opportunity to learn and present upon monoclonal antibodies.